Hey there, welcome back to the channel. This is Dr. Amber. Today we're going to be talking all about PCOS or polycystic ovarian syndrome. I have a lot of women in my practice who have this, have family members, have, symptoms that they think might be PCOS. So there can be an overlap between a woman experiencing hirsutism, which is hair growth in places than we want it, acne, right? A lot of these symptoms that is PCOS-like in nature, but maybe not exactly PCOS. So if you have PCOS, you're going to want to listen to this talk. If you don't, but maybe you know somebody who does, or you have a friend or a sister who does, this also would be helpful to learn more. Today, we're going to talk about two little known treatments or options for treatment for PCOS. And these are two that you may have heard of. You may not know that they actually work for PCOS, so stay tuned, we'll dive into that. PCOS is a really common hormonal disorder that affects up to 10% of women of reproductive age. And it's characterized by these irregular periods, sometimes up to 60 days apart or longer, excess androgen levels, so having high DHEA, high testosterone on lab testing, and then ovarian cysts as well can be a part of this. Many women will also experience acne and hirsutism, which is hair growth in places that you don't want hair growth, like the face or the chest. And then PCOS can also lead to that insulin resistance and even to type 2 diabetes. So it has blood sugar dysregulation component to it, which drives the inflammatory component here. And then that can also affect the hormone levels. And oftentimes, because the cycles are so dysregulated and irregular, it's driven by those hormone levels like low estrogen, low progesterone in many women, and high testosterone. I will say in my experience that when I see PCOS, it often happens in women who are very driven, have, a lot going on. They're pursuing higher education, they own companies, right? It's very driven, ambitious women because there is a component of stress and adrenal overactivation to this. The adrenals produce testosterone as well as the ovaries. So they can go into overdrive producing cortisol and then testosterone and then lead to a lot of these symptoms. So what are the two lesser known or maybe less used treatments to treat PCOS? One of them is semaglutide, that peptide that you've been hearing tons about because Oprah and every celebrity is taking it. And then naltrexone or low dose naltrexone is a really helpful option as well. And so there's so much that can be done through diet, through lifestyle, sleep, lowering stress, right? There's so many options to improve the hormone levels, the blood sugar regulation, reduce inflammation. But these two play a role in supporting that, and I'll talk about why. So semaglutide, we've talked about in other videos. It's a glucagon-like peptide, a GLP-1 receptor agonist. It's used to treat type 2 diabetes. What it does is it keeps those blood sugar levels stable, and it improves insulin sensitivity, which is great in PCOS because it's really driven by poor insulin sensitivity. There have been studies that shown that semaglutide can improve insulin resistance, reduce body weight, regulate menstrual cycles in women with PCOS, as well as reduce appetite, a lot of those cravings. I have a few case studies of women who have benefited tremendously from the semaglutide in improving PCOS. And it's not something that has to be taken forever. It can be used for a short period of time, 2 to 3 months, to really just improve body composition, improve the insulin, glucose regulation, and then also it can really improve periods. And you can see those changes on hormone testing, like a Dutch test. So by improving insulin sensitivity, reducing those blood sugar levels, semaglutide can really prevent the long-term health consequences of PCOS, which can lead to type 2 diabetes. There can be infertility concerns, right? A lot of the downstream inflammatory effects of PCOS, high testosterone. So semaglutide is an option to consider, especially if diet and lifestyle haven't really changed a ton in terms of how you're feeling and symptoms. So many people ask, well, is semaglutide safe? Is there side effects? And generally, semaglutide or Ozempic, is by another name, is generally safe and well tolerated. It does have some side effects, right? Like many medications do. So it has a lot of those GI side effects. like nausea, vomiting, diarrhea, right? Nausea is the most common one. So usually I start really low and slow with women who have PCOS. We're just trying to get a dosage to help with the insulin sensitivity. And so some women with PCOS may need some support to help drop that weight, right? Other women don't need to lose weight. And so we're really adding in a very low dose, less frequently for them. And that's a protocol that I walk through with women with PCOS one-on-one when we meet for an appointment. So the second option is something called low-dose naltrexone. And it surprises me how many people have not heard about this. There is a lot of research and a lot of case studies on naltrexone. Originally, it was used for addiction and at really high doses, usually like 50 milligrams. But when we use it in low doses, we're using anywhere from 1.5 milligrams, which is typically a starting amount, to 4.5 milligrams. And this is a prescription. It's a very low dose, generally well tolerated. There are some side effects to this one that might be like abdominal pain, nausea, loss of appetite, loose stools, headaches, chest and muscle pains. I've heard people sometimes will have really intense dreams if they're prone to that, so like nightmares. So that's something to look out for as well. It's contraindicated in people who have hepatitis, liver failure, who are currently taking opioids. You also don't want to take with alcohol or acetaminophen or some of these other drugs. There is a contraindication there. There's actual studies that show that naltrexone or low doses of naltrexone can help with the metabolic dysfunction in PCOS. And essentially, they use different medications like metformin, vitamin D, acarbose, orlistat, statins, and naltrexone. And they did find that naltrexone resulted in a significant reduction of fasting insulin level following glucose consumption. Very helpful in this case. Naltrexone helped with the blood sugar dysregulation that leads to all of the other symptoms of PCOS. There was 2 other studies that I will link in the video notes. One of them showed that BMI decreased significantly from 30 to 26 during treatment with naltrexone, and they were taking actually a quite high dose of naltrexone, about 50 milligrams for 6 months. But usually we're using it in a much lower dose in women. And the menstrual cycle also improved in 80% of PCOS women. Wow, so that's awesome. They saw free testosterone, DHEA sulfate, and cortisol, as well as androstenedione, which is a metabolite of testosterone, also decreased significantly. And then the fasting glucose to insulin ratio improved in people, in those women with PCOS who had insulin resistance. So wow, that is awesome. Not only did it improve the hormones, it helped with body composition, and it helped with insulin and glucose levels and cortisol. And then the third study, we used naltrexone in clomiphene-resistant women with PCOS. And so that study also showed that naltrexone improved endocrine and metabolic function in women with PCOS, right? So it brought back sensitivity to something like clomiphene, and it resulted in pregnancies. This group, they did this trial on about 30 infertile PCOS patients, and they were able to improve their fertility, improve the infrequent menstrual cycles, and then actually sustain a pregnancy. So that is very encouraging. And of course, I've used naltrexone myself. I found it very helpful for reducing inflammation. I used it when I was detoxing mold, and it can really help with regulating the inflammatory response in the body. So there's other places in PCOS where naltrexone is helpful, and autoimmunity it's really helpful. And then in a lot of these other chronic inflammatory issues, chronic infections, naltrexone is a go-to. Of course, before trying any new treatment or drug, I encourage you to discuss with your medical provider. None of this is medical advice. I'm just giving you information and education. And although I am a doctor, I'm not your specific doctor. And so definitely talk with your doctor, dive deeper. I'll put the links at the description of the video if you're curious to learn more. So in summary, the 2 best treatments, more next level treatments after we've done diet and lifestyle and so many other things to treat or to address PCOS is semaglutide or Ozempic, and naltrexone, the low-dose naltrexone. Those 2 really helpful. I've seen it in case studies of my own patients, my own experience. And so if you're curious about those, feel free to reach out for more information. If you have experience using those, please comment what your experience was. Was it positive? Did you have side effects? What did you notice from those different options? Hope this was helpful. Thank you for tuning into the channel, and I will see you in the next video.